Hey everybody, I'm Dr. Shirine Hegazi, chiropractor here in Fairfax, Virginia. Today I'm going to talk about the Graston technique. The Graston technique is an interdisciplinary treatment we use here at Concept Chiropractic, and I use it for all kinds of conditions, but today I'm going to show you how it works well with low back pain and chronic low back pain injuries. The main focus of the Graston technique really is reduction of adhesions and scar tissue that are a result of several different things. Some of the most common things that it results from is trauma, post-surgical scar tissue, muscular weakness, and those types of things. So in the next couple of minutes I'm going to give you a demonstration on one of my patients on how the Graston technique works. So I hope you find some value to that. Thanks a lot. Hello everyone, like I said, we're going to demonstrate the low back pain treatment called the Graston technique for low back pain. I just want you to remember that the Graston technique is not just for low back pain. It's a really great technique for a lot of other joints in the body, like the shoulder and the neck and the knee, and specifically for a lot of athletic injuries like sprained ankles and sprained knees and things like that. But specifically what I'm going to demonstrate today, it's why it's really helpful for the low back. As you can see, the tissue is really thick down here in the low back, and as Americans, a lot of us sit down in front of computers all day and really struggle with our posture and weakness in the low back. And weakness is what develops a tightness in the low back, which develops adhesions. Adhesions are basically like the knots you feel in a lot of people's shoulders who get really tight and who have bad posture, so to say. So what we're going to do today is basically show how I deal with those knots and deal with those adhesions, and what the next step is in terms of the recovery process for each patient. So basically, this is the Graston technique tool that I use for several different joints in the body, but we're going to use this tool today on my patient here. So in this fashion towards the head, I would go very deep on, depending on the case and depending on the chronicity of each condition, and work the muscle like you see right here. And really, we would do each side depending on the case. But in this case, this patient is dealing with low back pain on either side. So what I'm doing right now, like I said in the beginning, is I'm reducing adhesions, reducing those knots, minimizing those knots. And the goal behind minimizing those knots is to reduce or to increase the range of motion and flexibility of the low back joint. And that's important because you really need to have flexibility and range of motion to perform certain exercises. And without having the range of motion and flexibility of certain joints in the body, then you can't possibly fulfill end range motion for certain exercises. You need to complete range of motion to acquire strength in certain joints, in all of the joints in the body. Strength can never be achieved without performing a full range of motion throughout any movement. So that's why reducing and eliminating scar tissue and adhesions is a very important factor into that recovery process. So if you are dealing with low back pain, or you know of anyone who's dealing with low back pain, please don't hesitate to give our office a call, and we can certainly evaluate you and help you. And we hope to see you soon. Thank you very much. Hey, thank you very much for watching our video today. And if you have been suffering from low back pain, or have been a chronic sufferer of low back pain, please don't hesitate to give us a call, and we can give you an evaluation and see if we can point you in the right direction. Thank you very much.